There's a whole theory behind prolonged exposure, which is a cognitive behavioral therapy. And the theory is emotional processing theory. And basically what that says is there are parts of our brain that are responsible for learning and memory. And our brain's job is to try to survive and thrive. And if we're surviving, then we're allowed to thrive as well. But experiencing a trauma is more likely to focus those resources in our brain on only surviving. So those parts of our brain become much more allocated to trying to recognize if any threats are present, and we'll actually see threats that are present when none are really there, or we'll overestimate how bad those threats might be if there is a threat present. And really it's our mind's job of trying to protect us and to not have the event happen again, but it ends up using all of our available resources to try to survive instead of to thrive. So prolonged exposure, basically what that tries to do is it tries to help us get back in contact in order to change these experiences and to add more of a thriving component instead of only trying to survive. It tries to, we need to actually be able to reconnect with the event itself. We won't be able to learn anything new unless we actually can access the fear, and then we need to introduce new information that will not be in line with what the fear tells us is important about the world or our surroundings. So we need to be able to know that there's more information out there, that there is safety in the current environment, and not just expect that the worst is going to happen. Basically, most people that complete the program do show significant symptom reduction, and in some studies, it's sometimes around about two-thirds of the people actually no longer meet a diagnosis of PTSD. So it's been one of the most well-validated treatments for PTSD that exists in our treatment community today.